students, in this class we are discussing about alcoholism and its ill effects. Like smoking, alcohol is also injurious to health. Overconsumption of alcohol is one of the leading preventable causes of death worldwide. The word alcohol refers to ethyl alcohol. Chemically it is C2H5OH. It is highly volatile, that is, it gets evaporated very easily. Then it is highly inflammable and it is a colorless liquid having penetrating odor and burning taste. Ethyl alcohol is formed by the distillation of fermented grains, fruit juices, dry dates, molasses, sugars and starch with the help of yeast enzymes. Any substrate which is rich in carbohydrate content can be fermented to produce ethyl alcohol. The differences in the color and taste of alcohol is dependent on the source of carbohydrate that is used for fermentation. Since most of these are plant products, they will be having other chemical compounds in the plant products and they can influence the color as well as the taste of alcohol. Alcohol is consumed in the form of beer, toddy, wine, arrack, brandy, whiskey, rum, gin, etc. There are different types of alcoholic beverages. They are broadly classified into undistilled and distilled beverages. Undistilled beverages are produced by a simple fermentation of grains and fruit juices. And this includes liquors and wine. Liquors are made by adding sugar and flavoring agents from the plant sources and they are then fermented. Wines are made from different fruits such as grapes, peaches, plums or apricots. So liquors and wines are coming under the category of undistilled alcoholic beverages. Distilled alcoholic beverages are produced by the distillation of fermented product, that is obtained by the fermentation of grapes and other fruit juices. These fermentation products are then subjected to distillation and this distillation raises the strength of the ethyl alcohol and it is called spirit. The alcoholic content or the content of ethyl alcohol or ethanol in the distilled beverages ranges from 40 to 50%. Examples of distilled alcoholic beverages include brandy, whiskey, rum, gin, etc. Flavor of alcoholic beverages is due to the presence of ethers and esters in them, which can vary depending upon the source which was used for the fermentation process. Coming to alcoholism, alcoholism is the addiction to alcohol. Usually people begin to consume alcohol with small doses, often in social gatherings, but they will not get limited with that. They will soon start consuming larger doses. They will start consuming alcohol even at home. Finally, they will become addicts. Most of the people who start drinking alcohol, they start doing this for several reasons, which can be for excitement, feeling of independence, desire to escape from the realities of life, disappointments in life, etc. Because of all these reasons, they start drinking alcohol and they feel that their stress is relieved, but ultimately they will become addicted. By the time they realize that their health is affected because of alcohol consumption, it will be too late to give it up. That is how they are getting addicted to alcohol consumption. What is the reason for this addiction? The regular intake of alcohol can change the brain chemistry. Normally, impulsive actions of our body are controlled by gamma-aminobutyric acid or GABA. GABA is a neurotransmitter produced in the brain. Impulsive actions are the actions which we do without any forethought, or they are the behavioral or emotional responses without any forethought. It is because of the production of GABA that we are able to control our impulsive actions, think wisely and behave accordingly. But alcohol consumption decreases the function of GABA and the person loses emotional control. In addition to that, alcohol causes an increased secretion of dopamine. This dopamine is another neurotransmitter and it is responsible for a pleasurable feeling. This alteration in brain chemistry, that is decreased secretion of GABA and increased production of dopamine with regular alcohol intake, causes the body to crave for the pleasurable feeling, and that is how the person is getting addicted to alcohol. Coming to the health effects of alcoholism, alcohol consumption is affecting all parts of the body. It can cause brain damage, stomach complications, liver damage, pancreatitis, intestinal complications. It can weaken the immune system, It can cause congenital abnormalities or birth defects in children. Lungs and heart are also affected. In short, all organ systems of the body are affected because of regular chronic consumption of alcohol. Now let us see the effects of alcohol consumption on cardiovascular system. Alcohol consumption causes an increased risk of cardiac failure. Even moderate consumption of alcohol can cause an increase in blood pressure, that is called hypertension. Alcohol consumption causes an increase in the concentration of triglycerides. Triglycerides are a category of lipids or fats, and the amount of triglycerides increases in the blood as a result of alcohol consumption. And that condition is called hypertriglyceridemia. It also increases the risk of stroke. The triglycerides can form cholesterol which gets deposited inside the blood vessels to the brain, and supply of blood to the brain through these blood vessels will be decreased or even blocked. This can result in stroke. Alcohol consumption can cause anemia. Anemia is the reduction in the amount of hemoglobin in blood. These are the effects of alcohol consumption on cardiovascular system. Alcohol consumption is also having an adverse effect on nervous system. It causes brain shrinkage. Here in this picture you can see the brain of a non-alcoholic person and an alcohol addicted person of the same age. You can see considerable shrinkage in the brain of an alcoholic person. Alcohol consumption also causes several neuropsychiatric complications and several cognitive disorders. Cognitive disorders are the disorders of the thought, intellectual functions, memory, language and speech. All these cognitive functions of the brain will get affected because of regular consumption of alcohol. Then alcohol consumption can cause dementia, that is loss of memory. As I told earlier, alcohol consumption can cause a distortion of brain chemistry, that is it causes a decrease in the production of GABA and an increase in the production of dopamine. Then chronic alcohol consumption can result in the increased plasma level of the toxic amino acid homocysteine. As a result of alcohol consumption, the toxic amino acid homocysteine will be produced in the blood at high levels, and this homocysteine is responsible for causing alcohol withdrawal seizures. If an alcoholic person is not getting alcohol, his body will show certain withdrawal seizures, and it is because of the presence of homocysteine produced earlier as a result of his chronic alcohol consumption. The alcohol related brain atrophy and cognitive disturbances also occur due to increased levels of homocysteine. Then, as I told earlier, heavy drinking can cause stroke because of the deposition of cholesterol in the blood vessels supplying the brain. Because of the shortage of blood supply to the brain tissues show degeneration or lesions. All these brain damage is not only due to the toxic effects of alcohol but also due to nutritional deficiency, electrolyte disturbances and liver damage. Most of the chronic alcohol addicts prefer to drink alcohol and they avoid food. Because of that, nutritional deficiency occurs and all these can affect the brain. Then effect of alcohol consumption on mental health. Alcohol has an anesthetic effect on the nervous system. Since the alcohol is changing the brain chemistry, the person loses his judgment, willpower and self-control. So the thought processes, that is thinking and memory, are affected because of alcohol consumption, and he loses his emotional control. A chronic alcohol addict will show variations in emotional expressions. Sometimes he will be feeling a great joy and he may show this joy by a foolish laughter, and suddenly he may switch over to sadness and he may start weeping. This is because he actually lost his control of emotions. Another thing is that the inhibition disappears. The alcohol relaxes the brain, and because of that his inhibition will be lost and he may express his emotions without any wise thinking even in public places. This can lead to antisocial behavior, and suicide rate is also high among alcoholics. The alcoholics also suffer from psychiatric disorders like depression, anxiety and panic disorders. Next, let us see what are the effects of alcoholism on gastrointestinal tract or the digestive system. Consumption of alcohol in small doses stimulates the secretion of gastric juices. But consumption of alcohol in larger doses can cause highly increased secretion of gastric juice. The gastric juice contains hydrochloric acid. The high acidity of the gastric juice results in the painful inflammation of gastric lining, which is called gastritis. Alcohol, as it is consumed and flows down the esophagus, it causes a burning sensation and causes damage to the esophageal lining. Since alcohol affects the lining of the gastrointestinal tract, nutrients will not be absorbed properly. This malabsorption of nutrients can cause diarrhea, deficiency of calcium, iron, and vitamins. Chronic heavy drinking of alcohol can result in a condition called Mallory-Weiss syndrome. Drinking too much of alcohol causes violent vomiting, and as the person vomits, the gastric contents are pushed back into the esophagus. As I told earlier, gastric juice is acidic due to the presence of hydrochloric acid. This acidity may lacerate the lower end of esophagus, and sometimes it can result in bleeding also. This condition is called Mallory-Weiss syndrome. Alcohol consumption can do great damage to the liver. In the liver, alcohol is changed into more toxic acetaldehyde. The acetaldehyde can do damage to the liver tissues. Then liver also synthesizes fat from alcohol. The excess of fat reduces the synthesis of glycogen, enzymes, and structural proteins. You know that liver is a metabolic machinery in our body. It carries out the important metabolic reactions for which enzymes and proteins are very essential. Liver is also a storehouse of glycogen in normal case. But because of the damage due to alcohol consumption, metabolic functions of the liver are upset. Instead of doing the metabolic functions, it becomes merely a storehouse of fat. This causes fatty liver syndrome. Then the liver gradually hardens and dries up as the hepatic cells are replaced by fibrous tissue. This kind of liver degeneration is called liver cirrhosis. Use of alcohol causes painful inflammation of pancreas called pancreatitis. This can lead to lack of pancreatic juice. The damage to pancreas may lead to diabetes because of the adverse effect on islets of Langerhans, which are the endocrine cells that produce the hormone insulin. As in the case of liver and pancreas, heavy alcohol consumption also affects the critical cellular functions in lungs. Damage to the cellular functions make the person susceptible to lung diseases like pneumonia. In addition to that, alcoholics have a higher risk of developing acute respiratory distress syndrome, which is in short called ARDS. The alveolar walls get thickened and fluid gets accumulated inside the alveoli. This prevents gas exchange. The mortality rate due to ARDS is higher in the case of alcoholics when compared to non-alcoholics. Chronic alcoholism also causes serious damage to sexual function of a person. Long-term heavy drinking can damage the central and peripheral nervous system. This can lead to loss of sexual desire and impotence in men. Alcoholism can also lead to hormonal imbalance because of the presence of estrogen-like compounds. In females, it can result in hyperestrogenization and can cause an increased risk of breast cancer. In males, hyperestrogenization can lead to testicular failure and development of feminine characters like development of breasts, which is called gynecomastia. As in the case of smoking, alcoholics are also at a higher risk of cancer. Cancer due to alcoholism can affect different parts of the body like mouth, throat, larynx, esophagus, breast, liver, colon, and rectum. As I told earlier, when ethanol is broken down in liver, a toxic compound called acetaldehyde is formed. And it is this acetaldehyde that damages the DNA in healthy cells and causes the cells to become cancerous. If the pregnant mothers drink alcohol, then the fetus also comes under the risk of adverse effects of alcoholism. Alcohol can cross the placental barrier and it can affect the growth of the fetus. Babies of alcoholic mothers are often unhealthy and underweight, and they develop what is called fetal alcohol syndrome. It is characterized by underweight and unhealthy condition, facial abnormalities, limb defect, defective heart, and also mental retardation due to damaged neurons. Alcohol is costly, but the alcoholics do not mind spending on it to satisfy their selfish desire. They deprive their family members of their basic needs. This creates all sorts of domestic problems, including quarrels and divorce. Anxiety, frustration, and insecurity in children are common among the children of alcoholic persons. Children may neglect studies, develop inferiority complex, and often become antisocial. Alcoholics often abstain themselves from work due to drinking, and they may lose their job. This reduces the family income. Alcoholics are often in debt. This leads to antisocial activities such as corruption and crime. Family members of alcoholics often suffer from malnutrition and diseases associated with it. Friends and relatives often avoid alcoholics due to foul smell they emit, misbehavior, and antisocial activities. Thus, the whole family feels isolated from the society. Alcoholism is associated with social crimes and erosion of moral inhibitions. Corrupt practices in the society are often directly or indirectly due to drinking. Violence is another outcome of alcoholism. Accidents on roads and industries increase due to alcoholism. Distillation and sale of illicit liquor increase antisocial activities. Alcoholism was declared as a disease by WHO, and an alcoholic is a sick person. He needs the attention of family members and friends to give up this habit. This is possible under proper medical supervision. There comes the importance of alcohol de-addiction. De-addiction of alcoholism is known as de-alcoholism. De-addiction of an alcoholic is done in a way that is safe for the patient and causes minimum discomfort to that person. Recovery from alcohol dependence is greatly aided by counseling, and rehabilitation of an alcohol addict is a step-by-step process that requires the support of a doctor, family members, and friends. But the treatment remains unsuccessful until the patient himself is willing to quit alcohol. A chronic alcoholic person is so highly dependent on alcohol that he will show withdrawal symptoms if he is not provided with alcohol. This is because of the toxic effects that alcohol has done to his body. So the first thing to be done in de-addiction is detoxification. Detoxification is the process of allowing the body to get rid of the toxic effects of alcohol while managing the symptoms of withdrawal. The alcoholic who wants to give up drinking is first thoroughly checked up by a physician to know how much damage his body has suffered due to drinking. This will help him in deciding the type of treatment required. The patient is recommended adequate nutrition and rest, and he is not provided with alcohol for a certain duration of time. During this drying out period, the withdrawal symptoms that he develops are assessed, and based on that, treatment is decided. Next thing that we have to do in alcohol de-addiction is to educate the alcoholic person. Mostly, the alcoholics continue on alcoholism because they are not aware of its harmful effects. The education program teaches the alcohol addicts about the toxic effects of alcohol on their body and the consequences if they continue to use it. Alcohol addicts can be given counseling and group therapy. The patients receive individual counseling with a trained counselor. They can also participate in group therapy meetings with other addicts and de-addicts. The de-addicts can share their experiences on how better they feel after de-addiction. This can be a motivation for people who undergo de-addiction treatment. These counseling and group therapy sessions are designed to teach the patient about the skills that are required to live life without alcohol. The patients are taught to recognize the situations in which they are most likely to drink alcohol and how to avoid these circumstances if possible. Including family and friends in the educational process significantly improves the outcome of the rehabilitation program, because support from family members is very essential for the person to come out of addiction. During the de-addiction treatment, the person is in a structured environment where no alcohol is available. After that, the person is coming to the real life situations where he may again be tempted to drink alcohol. Hence, aftercare program is also very important. Here, the de-addicted person can interact with the counselor and get suggestions to avoid the situations that might again cause addiction. In this session, we have discussed about the ill effects of alcoholism and the programs for alcohol de-addiction. Thank you.